Thanks very much. I'd like to thank the Nestle Nutrition Institute for giving me this opportunity to talk to you about obesity in toddlers and young children, its causes and consequences of both short and long-term health. And as always, I'm going to start off with the words of Thomas Edison, who said the doctor of the future will no longer treat the human frame with drugs, rather will cure and prevent disease with nutrition. Now, as you know, when Edison wrote this, the main interest in nutrition was for meeting your nutritional requirements. And for much of the world where malnutrition is common, this is still actually the case. But in the 21st century, we've gone from problems of nutritional deficiency to nutritional excess. And this is truly a global problem. So if you look at the percentage of children who are already overweight by 5 years of age, you can see this is something that affects both richer countries and for poorer countries. Now, fortunately, Brazil isn't so bad because only 5 to 10% of children are already overweight by 5 years of age. So in this presentation, I'm going to try and answer three important questions. What are the causes of obesity in toddlers and young children? What are its consequences, both for short and long-term health? And finally, briefly, I'm just going to mention what we can do. But before that, I just want to try and answer one very important question. Why is obesity in toddlers, as opposed to older children, such a major issue? Well, there are two reasons for this. Firstly, it's because of studies such as the Early Bird study published in 2009, which showed that actually obesity, 70 to 90% of obesity is already established by the time a child starts school, and it simply tracks after that. So preventing obesity in the toddler years is going to be critical for their long-term health. And this has been replicated in a large study published in the New England Journal of Medicine in 2018. This showed that children with rapid weight gain between 2 and 6 years of age were 1.4 times more likely to become obese as adolescents. This is a study in 51,000 children. And the second reason is that what toddlers eat, in other words, their dietary patterns, is set very early in life and tracks for later eating patterns. And we know these dietary patterns are associated with later obesity. So optimizing nutrition in the toddler age group is going to be critical for prevention of obesity and its consequences throughout life. Okay, so what are the causes of obesity in toddlers and young children? Well, we know at the simplest level, obesity results from energy intake being greater than energy expenditure. This imbalance doesn't have to be very much. A few calories will add up to a huge amount of fat mass. And we know your genes and your environment, and more recently developmental factors, influence energy balance and hence your risk of developing obesity throughout life. Now, developmental factors include how you're fed in infancy, your pattern of growth, and nutrition in the toddler age group. And it's this concept of developmental factors interacting with the gene's environment which gives us a whole new opportunity for the prevention of obesity, the so-called developmental origins of adult disease hypothesis. And I'm going to focus in these three areas individually in turn. So starting off with genes. Now, there's no doubt that genetic factors make a major contribution to an individual's risk of developing obesity. We know from studies in identical twins that additive genetic factors account for about 40 to 70% of the variability between individuals. We also know from adoption studies that a BMI of a child is more strongly related to both biological parents than to adoptive parents. This means as a child, you're 10 times more likely to become obese if both parents are obese. More recently, we've begun to identify some of these genes that genome-wide studies have identified over 100 loci associated with body mass index, the first being the FTO gene. The problem with genes is that on average, each gene increases body mass index by only 0.1 units, and obesity risk by about 10%. And of the 97 known genetic markers for obesity, together they explain only 2.7% of the phenotypical variation in population body mass index. So clearly, the environment is going to be critical. And as pointed out by the WHO and numerous public health bodies, obesity is the result of an inadequate behavioral response or biological response to an adverse environment. Now, it's important to remember this environment isn't just what the toddler eats. We know there are major biological, commercial, and social determinants of health, all of which affect the risk of obesity. And these risk factors all overlap. This was covered beautifully by Professor Sally Davis's report on how to solve childhood obesity. She's the Chief Medical Officer of the UK. Now, what's important about this is that obesity isn't just the result of a lack of willpower. And this is especially important in toddlers who are not responsible for their dietary intakes and also their behaviors, which are often led by the parents. So I'm going to focus particularly on the biological risk factors such as genes, which I've already mentioned, nutrition and developmental factors. Now, these risk factors also interact with the environment. So your genetic risk of becoming obese is far greater if you grow up in an adverse or an obesogenic environment compared to a supportive environment. So that's the big picture or the overall framework. The problem is, as healthcare professionals, we tend to have little control over the big picture. So we focus much more on individual risk factors for obesity. And here we need to understand the risk factors for energy balance, starting off with your diet. So what factors in the toddler diet may increase their risk of developing obesity? Now, as you can imagine, measuring diet in toddlers is difficult. Relatively few studies have done this. One study that has looked at this was the Alspach study, published in the 1990s and the early 2000s. This was a follow-up of 14,000 healthy term infants in the Bristol region in the UK. Now, as you'd expect, this showed that toddlers' diets are very poor. 5% had no fruit and vegetable intake, and 25% had a minimal intake. There's a huge social pattern gradient. So children whose mothers had a low level of education ate more chocolate, more white bread, chips, diet drinks, and tea. On the other hand, they had less cheese, fish, breakfast cereal, fruit, and fibers. In other words, they had less nutrient-dense food. And so the overall summary of the toddler diet is, as you'd expect, very poor, high fat intake, high sugar intake, not enough fruit and vegetables. But what you might be surprised about is that actually there are relatively few associations between energy, fat, and carbohydrate intake and risk of obesity in this age group. And there are numerous systematic reviews that have shown this, including a Cochrane systematic review. And the reason for this is that the energy balance doesn't have to be very much. A few kilocalories extra will add up to a large amount of fat mass. And studies find it difficult to measure this imbalance in energy intake versus energy expenditure. Another approach is to look at what factors in the toddler diet have changed over the last 20 to 50 years and coincided with the increase in obesity. Well, if you compare today's toddlers with the toddlers in the 1950s, you'd see actually they have a lower energy intake. And this is consistent with the idea they're not as active as they used to be, for example, not walking to school. Where the energy comes from is also different. They have less bread, potatoes, vegetables, but they have a staggering 25 times increase in sweet intake and 34 times increase in soft drinks and juices. So they're filling up with fats and sugars rather than complex carbohydrates, as is recommended. There's also been a huge increase in portion size. For example, the size of pizzas have gone up by 53% and the size of crisps by about 50% over the last 20 years. So the question really is, does this increase in portion size matter? Does it make any difference to these toddlers' risk of developing obesity? Well, we know from many systematic reviews and meta-analyses that larger portions and increased energy-dense diets affect both the energy intake, increasing it by about 10 to 15%, and also increased body size. This is known as the portion size effect, and something that's seen in both children and in adults. What's interesting is that portion size appears to affect energy intake in 5-year-olds, but not in 3-year-olds. And this is consistent with the idea that 3-year-olds respond to the appetite, while 5-year-olds respond to their social cues. Now, this observation was first made over 20 years ago, but it's been confirmed in a recent systematic review by Small. Okay, so are there particular changes in foods in the toddler age groups which increase their risk of developing obesity? Now, I've already mentioned that there's been a huge increase in sugar intake in toddlers and young children, and several systematic reviews have now shown consistent associations between high sugar intake and increased risk of developing obesity. Now, as a result, numerous public health bodies, such as the WHO, the Public Health England, Scientific Advisory Committee on Nutrition, and ESPGHAN, European Society of Paediatric Gastroenterology, Hepatology and Nutrition, have all said that the average intake of free sugars should not exceed 5% of total dietary energy intake. Now, this sounds easy, but it's actually quite difficult to do. So if you look at a 3-year-old child, 5% of energy intake is about 13 grams of sugar, 3 teaspoons of sugar, or 170 mils of fruit juice. So something that's not going to be easy to do. Okay, what about the other side of the energy balance equation? Now, we know that physical activity is important for health. Does sedentary behavior, for example, too much screen times in front of a television or a computer, insufficient physical activity, cause obesity in toddlers and young children? Physical activity is no doubt important for health, for cardiovascular health, for social, cognitive, physical development. But you might be surprised to hear there are actually very few consistent associations between objectively measured physical activity or sedentary behavior, such as screen time, and obesity in toddlers. And again, this is for the same reason. The energy imbalance doesn't have to be very much, and it's actually difficult for studies to measure the energy imbalance, which increases your risk of developing obesity. Now, there's much more consistent, and the Cochrane systematic review actually is consistent with this. This is for interventions for prevention of obesity in children, based on children 0 to 5 years. This Cochrane systematic review said that interventions that focus only on physical activity do not appear to be effective. There's much more consistent evidence for a lack of sleep and an increased risk of developing obesity, possibly by effects on appetite. Now, there are 7 cohort studies that showed that toddlers that don't get enough sleep are at a higher risk of developing obesity. The problem is these are all observational, and so it's difficult to cause a link between not enough sleep and an increased risk of developing obesity. Okay, so I've talked a little bit about genes, mentioned the environment, which is going to be absolutely critical, but what about developmental factors, such as how you're fed in infancy, your pattern of growth, and your nutrition in the toddler age group? Well, we know that nutrition has a role beyond that of meeting nutritional requirements and really matters for long-term health outcomes such as cognitive function, bone health, atopic disease, and risk of obesity. The developmental origins of adult disease hypothesis based on the concept of programming, the process by which a stimulus insult, such as breastfeeding, applied at a critical window in development, has a long-term, permanent effect on the structure and function of an organism, your risk of obesity many years later. And the strongest evidence for nutritional programming in humans really comes from the effects of breastfeeding reducing the long-term risk of developing obesity. There are 9 systematic reviews show that breastfed infants are less risk of developing obesity, 113 studies. If you look at the evidence overall, there's a 20% reduction of obesity risk with breastfeeding, but if you look at the best studies, there's about a 13% low risk of developing obesity. And this has been confirmed in a systematic review, 3 systematic reviews of systematic reviews, which have shown a 13% reduction in later obesity with breastfeeding. Now, we don't know the mechanism for this, but one mechanism we put forward many years ago is that the reason that breastfed babies do better is that breast milk is associated with slower growth and relative undernutrition compared to formula milk, the growth acceleration hypothesis. And by growth acceleration, I mean upward crossing in centiles for weight or for length, as shown here. Now, since we published this hypothesis, and now 7 systematic reviews showing that faster growth in infancy increases the risk of developing later obesity. It's been something that's been seen in low-income countries and high-income countries for weight gain and for length gain. The problem is these studies are observational, so again, it's difficult to establish a causal link between faster growth and long-term obesity. We now have some randomized controlled trials that confirm this hypothesis. Faster growth in infancy as a result of a high protein intake increases the risk of obesity later in life. And here we have all the data. The first studies were in preterm infants. We have 2 studies in healthy term SGA infants and 2 studies in healthy term infants. The interventions ranged from the first few weeks to the first 12 months. The interventions were all in the first year, various different outcomes such as blood pressure, insulin, blood pressure, fat mass, and body mass index. The key thing here is that these risk factors affect later risk of developing obesity. The largest of these studies was the EU obesity study, excuse me, which showed that high protein intake in the first year of life doubled your risk of excess body fat at 6 years and increased visceral fat mass as measured by your preperitoneal fat using ultrasound at 5 years of age. Now, this isn't something that's just confined to in the first year of life. We looked at older children between 6 months and 36 months of age and found that in 19 out of 24 studies, a high protein intake in infancy was associated with a greater risk of developing obesity, with an effect size of about 0.3 SD scores. There was no effect for carbohydrate or for fat mass. What are the practical implications of this sort of data? Well, firstly, parents need to understand that bigger is not always better. And secondly, we know that cow's milk, which is high protein intake promotes rapid weight gain. We know it's not recommended in the first 12 months of life, but also should be restricted to less than 500 meals per day in older infants and toddlers. So, talked a little bit about the causes. What about the consequences of obesity in this age group? Now, we know that obesity has many short-term medical problems associated with it. There are many orthopedic problems, problems with hips, joints, slip femoral epiphyses are more common in children who are obese, problems with sleep, liver disease, high cholesterol concentration, and respiratory disease. For example, asthma is worse in children who are obese. Huge number of psychological issues, poor self-esteem, depression, bullying, leading to a poor quality of life, excuse me, and a poor academic achievement. But I think it's the long-term effects of obesity that turn out to be the most important. A systematic review of 23 studies have shown that children who are obese are 5 times more likely to become obese adults. But it's not just obesity. Each 1 unit increase in childhood body mass index increases the risk of coronary heart disease by 8%, the risk of type 2 diabetes by 20%, and cancer by 20%. So huge implications of childhood obesity into adult life. So what can we do? Well, here I'm just going to mention the 2 clear messages. Prevention to start early, especially in the toddler age group, and education of parents, healthcare professionals, and children is critical for the prevention of obesity. And this is something supported by the Cochrane Systematic Review for the Interventions for Prevention of Obesity in Children. They looked at 16 RCTs, over 6,000 children, largely educationally based interventions that showed that diet combined with physical activity can reduce the later risk of developing obesity. So in summary, I hope I've convinced you that the answer to this question, is nutrition and prevention of obesity in toddlers important, is clearly yes. What are its causes? These are complex, these are biological, economic, social determinants of health. When it comes to biological factors, your genes and the environment and developmental factors are all going to be important, but the environment is the most important. What are its consequences? Huge short-term consequences of being obese as a child, but it's a long-term effects for adult obesity and cardiovascular disease, which I think is particularly important. Not just health, we know from the McKinsey report published in 2014 that obesity has a huge economic burden in the UK and many other countries. We know that obesity costs the UK £47 billion per year, which is secondary only to smoking. And what can we do? Well, I think we really need to understand that optimizing nutrition in the toddler age groups really is a foundation for health throughout life. Thank you very much. And you can get more information from the Infant and Toddler Forum website. Thank you.